Healthcare. Oh boy, here we go. I'm a small business owner and I'm a former elected official. I'm out here in Jersey and I am someone who, generally speaking, I'm conservative, depends. But, anyways, healthcare. Here's my opinion and here's what you should be doing as a former elected official and a small business owner out here in New Jersey. So, number one, the our country, we're not asking for everyone to be covered because most of the country is covered. You have Medicare, Medicaid, you have people who are covered through their employer, you have people who are covered because they're billionaires or multimillionaires, and you have people like myself who just I pay my own insurance. So we're not asking for much. It's just covering a slice of the pie. I don't know why this is a big problem here. I mean, I know why because there's lobbyists and healthcare companies that have power, and I invest in those companies too. Truth be told, so I get it. But it really, if we're supposed to be the greatest, most powerful, most richest, most powerful, most greatest, most powerful, richest country that's ever more powerful, so rich and powerful, this country, really, we can't provide healthcare for my fellow citizens. I mean, come on. Now you may say, oh, it's going to cost too much money. Yeah, but we just gave half a trillion to that country and 900 billion to that country and a quarter trillion to that country and 900 billion to the other country and 45 billion to this country, another half trillion to that country and 700 billion to that country. But we don't have money for our own people. Really? I don't know. I mean, I thought America first here, folks. So we have the money. How do you have your family starve, but somehow you're giving food to the people across the street? Really? So when that stops, I'll believe it. But we got money. So we got plenty of money. So, subsidies have to be just continued. Just continue the subsidies, the Affordable Health Care Act. I know because I was somebody who benefited from that. They do work. They work very well. I have been on that and I loved it. So when people say they don't work, really? Because I was on them and I'm hoping to get back on the open marketplace too. So, I'm not some billionaire or multimillionaire. So there's a lot of good, hardworking people that's going to help. Now, you'll have people that say, well, there's illegals that would take advantage of that. Again, we have money for quarter of a trillion to that country, half a trillion to that other country, 900 billion to that country, 17 billion to that country, another quarter trillion to that other country. We give money to people who aren't American every day. No one's bitching about that. So again, we got the money to give to ourselves, and a couple of illegals take advantage of that. Again, we're giving money to other countries, though. So, yeah, it doesn't make sense. So we're going to cover our people. Sure, there'll be some that take advantage of this, like probably the illegal working at the diner I go to who's going to sneeze in my food. But if he's not sick and he has health care, then me and my daughter and my son and my family don't get sick. So, it's not. Come on, people. You know what I'm saying? We can do this. It's not a problem. The other thing I would say is if we love capitalism, and I'm a business owner, I love capitalism, let's do the business thing. Let's open up across state lines to shop for health insurance because there's over 1,000 private, healthcare providers, health insurance companies throughout our country. Why is it in New Jersey I only get to choose 7? I thought we were a capitalist country. I thought we were a business country. Open up the state borders. Stop with, oh, but regulations and we're worried about the consumer. There are people who have nothing. Something's better than nothing, even if it's clumsy and sloppy and not great. Okay. I've been someone who's had no health insurance. I've been somebody who has been on, welfare through my family and stuff like that growing up. I've been someone who has had the best health insurance and I've had the worst health insurance. I've had no health insurance, and I have health insurance now that I pay for. So I understand. I've walked in people's shoes. And if you haven't, then you don't understand my plight or other people's plights. And, hey, I mean, subsidies, senators and congressmen get free health care. I don't see them bitching about that subsidy. So there's enough to go around. I was a former elected official. That was open to me too. So, hey, if we're not going to subsidize, then stop the subsidies to senators and governors and assembly people and myself they should have stopped it when I was, you know what I mean? So we got the money. So I would say you can, again, have public and private, whoop-de-doo. We have public and private high schools and elementary schools. You want to buy your own private healthcare? Cool. There has to be a baseline. We're supposed to be the richest, most greatest country. How we treat the least of us is what we're going to be gauged on and measured on, not how we treat billionaires. It's the people, our veterans, our homeless, our single mothers, our families that are good, hardworking people that can't get health insurance or can't get enough. You should not be losing your home, which is the number one reason for foreclosure and going into poverty is usually it's health related issues. Come on now. There are countries that are bigger than America that have universal or baseline healthcare coverage, and there are countries that are smaller than America that have universal baseline healthcare coverage. So what's our excuse? I mean, and I think the thing comes in is, and I get it. I invest in these healthcare companies too. That's where it's at. You got these healthcare companies that, the lobbyists and, they're paying for dinners and wink, wink, wink. That's really what it's at. I understand that. But I'm asking you, please find your balls, please find your brass, and just break off a crumb. At the minimum, just reinstate the Affordable Health Care Act subsidies, because we're subsidizing the whole damn world. We got plenty of money. And if we don't, then stop the subsidies to the rest of the world and bring those hundreds of billions and trillions here. What? You know what I mean? So anyways, but yeah, you can expand Medicare, Medicaid by a little bit, by 1%. That would help, right? I mean, you could do that, shop across state lines. You can also continue to do, prescription reform, which has been done. That's a good thing. We can keep up with that. Let companies like Amazon continue to offer low cost, pills and medication. That's a good thing. We want to expand that stuff. You know what I mean? So there's things that we are doing, we can do. It doesn't take a lot. Again, most of the country's covered, honestly. So I don't know what. I think a lot of it too, because I used to be in politics. I get it. It's to stick up your ass and you got to show the other side. I'm going to get tough with them. Yeah, but we're suffering. You know what I'm saying? So no one's asking for the world here, but baseline, basic healthcare. By the way, it's a lot cheaper than everyone going into the ER, because people do that. Illegals do that. People with little or no or not enough healthcare go into the ER. And we all know, being in the ER, that's going to cost more than if you just went to the GP a month prior, not letting it get so crazy and so bad, your health issue. Now you're in the ER. And that costs more. So it's basic math. I'm a small business owner. Listen to me, okay? I know what I'm talking about. So anyways, I don't know. Tell me what you think in the comments below. Like I said, if we're not the richest, most powerful, so rich, so powerful country, if we're not, cool, then not healthcare for everybody. But I've been told we're the richest, most powerful, so rich, so powerful, so powerful, so rich. Then this is for our people, most of it. And again, people are going to fall through the cracks and take advantage of the system. Okay, we give $500 billion to that country, another $250 billion to that country, $900 billion to that country, $45 billion to that country, another $17 billion to that country, another $500 billion to that country. So what? No one's complaining. Help our people. And again, the illegal who's going to take advantage of the healthcare, they're not sneezing in my food because they're cooking at the diner. They're usually the people that are serving us. So really, getting them healthcare prevents me and my family from getting sick. You know what I'm saying? We're not handing out Lamborghinis here, folks. And most of it's going to help our U.S. disabled vets. Most of it's going to help the citizens of our country, 80+%. So anyways, I don't know. Tell me what you think. It's sad, because we have the power to do this. And, it's just people are afraid to, and it's all posturing. And I get it, the lobbyists and people want to act tough. But you're fucking the whole country, really, or a lot of the country, I should say. Anyways, thanks for listening. Bye. Oh, hit that like and subscribe.